Is everybody on now, Anu?
Yes, everyone is on, and it's over to you.
Okay, excellent. Welcome, everyone. It's great to see you joining for this global webinar organized by UNICEF and EPRI as part of our global webinar series. We're going to focus today on an evaluation that UNICEF commissioned for the work they've done in expanding universal child benefits. And we're going to look at the plus in social protection and draw on examples of good practice from both Uganda and India in terms of youth protection and gender empowerment and economic opportunity. So I'm delighted to introduce our chair and moderator for this session, Denis Jobin, who has more than 24 years experience in the field of program planning, monitoring, and evaluation. He's worked at the country office level and the global level and has expertise in performance management and audit and a rich understanding of how governments and the United Nations work and tackle these important challenges. Since 2018, he's the Senior Evaluation Specialist in the Headquarters Evaluation Office for UNICEF. He leads the equity portfolio, particularly for the 2022-2025 strategic plan, focusing on UNICEF's work in social protection, urban, and poverty reduction. Cindy, over to you to chair the session. Yeah. And if I could just ask everybody to mute their microphone if they're not talking, we'll move right ahead. Denis, over to you.
Thank you, Michael. Good morning, good afternoon, or good evening, distinguished participant, panelists, and colleague from across the world. And welcome to this global webinar co-sponsored by Evaluation Office, UNICEF, New York, and EPRI on a recent evaluation that we did on UNICEF work supporting expansion toward universal child benefit and identifying good practice. So just to give you a bit of a context, child benefit offer promising policy tools to promote the realization of children's rights, to reduce poverty and inequality, and to bolster dignity and social cohesion. However, there has been healthy debate among development partners between, from one side, targeted approach, and from the other side, universalism. Some of the arguments against universalism are resource availability and scarcity of resources, diverse need in different contexts where one size fits all may not be the most effective way to address local issues, risk of dilution of fund, spreading fund, or may not be have the desired impact on the most vulnerable children. However, there are arguments strongly supporting universalism, and some of which for UNICEF is the human right, for example. I don't know if you can go to the next slide. Universalism, which align with the belief that social protection is a basic human right as is covered a range of multi-deprivation. The opportunity to reach global standard in implementing UCB, Universal Child Benefit, we can help to establish global standard for children's welfare. Social cohesion is a great advantage for universalism, as universal benefit can foster a sense of solidarity and collective responsibility for child well-being across and within different societies. Lastly, the mitigation of global inequity. It's an excellent tool to work across region and globally. That universal child benefit can be a tool to mitigate global economies, disparities, especially in less developed countries where the majority may be need. In this context, that we have commissioned in 2022 global evaluation on UNICEF work supporting expansion toward universal child benefit. The key objective of the EFC evaluation were to what extent has UNICEF been relevant and effective in supporting government to mobilize resource for UCBs, in strengthening the capacity of government and the partners, in developing, sustaining, and leverage country-level partnership. The overarching purpose of the evaluation were twofold. First, to contribute to the global evidence based on the relevance and effective action by UNICEF and others that support the progressive expansion of child benefit. And lastly, but not last, to provide organizational direction to UNICEF as well as the development partner on how best to shape intervention in this area of work. So as part of this evaluation, we have identified a series of global not global, but good practices that we are here this morning to present. It's from two country cases that were selected. One is obviously Uganda, where we are located now, and the other is for India. Next slide, please. So let me introduce the next co-chair. Michael Samsung is the research director of the Economic Policy Research Institute, EPRI. It's a global research institute with offices in Cape Town, Bangkok. He has 38 years of experience working with government and development partner and with UN agencies in designing and planning, monitoring and evaluating social protection program, policies, cash, and so on. His project experience cover more than 66 countries in Africa, Latin America, Eastern Europe, Asia, and the Pacific, as well as many related publications. I'm not sure you needed to be introduced, actually. So over to you. Thank you.
Thank you, Denis, for that warm introduction. And I want to thank all of you. It's great to see such a wonderful turnout for this webinar. And this is our first global webinar broadcast live from Kampala. So you're part of a historic moment here in this webinar series. And speaking of Uganda, 17 years ago, the Minister of Finance from Uganda, I know you can take the bio slide off. We'll go slide free for a few minutes. Thank you. 17 years ago, the finance minister from Uganda led a delegation of government officials to Livingstone, Zambia, for the first African Union ministerial on social protection. And that was really the first community of practice for social protection on this continent. The Zambian government was riding the first wave of social protection, the social cash transfer program. And this engagement between Zambia and Uganda led to a process that evolved into the government of Uganda initiating the Social Assistance Grants for Empowerment, the SAGE program. In fact, all across Africa and across Asia, the first wave of social protection brought cash transfers to vulnerable households to tackle deprivation. And this process, the hallmark of this process was evidence building. As we heard from Denis, his work in evaluation, evaluation demonstrated that these cash transfer programs not only tackled poverty and vulnerability, they were promoting gender empowerment, particularly for girls and adolescent girls and young women. They built human capital. They strengthened employment opportunities. And this was surprising to the evaluators because this is not how we designed these programs. We designed these programs to tackle poverty, and yet we saw a whole range of developmental outcomes, largely unintended. And it raised that important question in Kampala and in Bihar. and in Dhaka and all across the global South, what would happen if we tried to design these programs to maximize empowerment opportunities and developmental impacts? And that question triggered the second wave of social protection, what we're here today to talk about, social protection plus. We're going to be looking at remarkable programs in Uganda that have been implemented, designed and implemented by the Kampala Capital City Authority with support from the national government, from UNICEF, from the Swedish International Development Cooperation Agency, from the Swedish Public Employment Agency and Capacity Building, and EPRI, a plus program that integrates key services and empowerment initiatives. And we're also going to look at a remarkable program in Bihar, India, MKUY, that has also been supported by UNICEF. And we want to look at good practice, not only in the plus programming that these governments are driving, but in the support that development partners like UNICEF have been providing to help catalyze evidence and capacity building and financing, and the other sorts of wind beneath the wings of government that are driving these programs forward. So with that, let me hand back to Denis to continue moderating this session.
Thank you, Michael. Can we go back to the slide? Okay, let me introduce the next two speakers for the next 20 minutes, 30 minutes. First, the next speaker will be Annette Nakimuli. I hope I pronounced it well. She is a monitoring and innovation specialist in the Kampala capital in Uganda. And she's an economist by training and a community development practitioner. She has more than 18 years of experience working with informal and vulnerable communities here in Kampala and in other regions. She has experience in designing program and project monitoring and evaluations, that scale data analysis and training, capacity building, and so on. The other speaker I'm going to introduce to both is on my right is Mr. Tawanda Chinemberi. He's also an economist with more than 18 years of experience in the area of policy analysis, program management, and research. He's currently the social policy manager in UNICEF Country Office, Uganda, leading the social protection and public finance portfolio since 2021. Previously, Tawanda worked as the chief of social policy in UNICEF Zimbabwe, overseeing the entire portfolio of child poverty, public finance, and social protection. Tawanda has worked as an economist in both the public sector and civil society. So welcome you both, and over to, who is the first? To Annette. Annette first. Thank you.
Thank you, Jobin, for that wonderful introduction. And good morning, good evening, and good afternoon to all of us that have joined this webinar. I'll rush you through the good practice of the Girls Empowering Girls program that is being implemented by the government of Uganda through Kampala Capital City Authority. We'll just first look at the socio-economic context of the challenges that are faced by the young people in Uganda. You'll find that in Uganda, there is an increased concentration of vulnerable children, especially in the cities, especially due to the rapid urbanization and the high population growth rates. And of all cities in the country of Uganda, Kampala is host to many vulnerable young people who come to that city through the rural urban migration, just finding their way in search of employment and other better services. But also there is a thinking that the young people that are living in the city are generally considered better in terms of greater access to services and more diverse income generating opportunities. But also these young people in the cities are also exposed to a number of risks. The adolescent girls in particular face risks including early marriages, they drop out of school, there is adolescent and teenage pregnancies, sexual and gender-based violence, high risk to HIV infection as compared to their male counterparts. We'll also find that in Uganda, the children and youth who come from the poorest urban households, they do not have fair access to other services like protection, education, water and sanitation, housing, name it. They don't have access to those services. Due to the multidimensional and intersecting vulnerabilities that are faced by the adolescent girls in the city, coming up with a cash-only social protection program becomes inadequate in addressing the multiple risks and vulnerabilities that these girls face in the city. As we come up with the social protection programs, it has to be it has to offer complementary services to the cash benefit. You find that due to the risks, the girls will need more than just cash, but they need information, they need knowledge, they need access to services, but they also need livelihood development activities to be linked to. And in 2018, KCCA, being supported by UNICEF and EPRI, embarked on a mission to design and implement a social protection program for adolescent girls in Uganda. And it was aiming at addressing the unique set of vulnerabilities that are faced by the adolescent girls in Kampala, especially in the areas of education, health, and protection. And that is the girls, empowering girls. The objective of the girls empowering girls to ensure that the girls transition safely into adulthood, receive education and training, and also are empowered to achieve their goals in life. That is the objective of the Girls Empowering Girls program. And the Girls Empowering Girls program that we call the GEG has three main pillars. It has the mentoring pillar that in this we empower girls through a network of peer mentors. The next pillar is the referral to services. We engage the girls through education, training, and we also refer them to support services. Of course, we have the cash transfers that enables girls to pursue better opportunities for their future through that small cash transfer program. But we emphasize in the GEG program that the backbone for the program is the mentoring, because we know that without the mentoring, then the other set of cash may not be very adequate. So we really emphasize the issue of the mentoring to the girls, because it is through this that they have access to information, that they are empowered in one way or another. What is the targeting for the GEG? The GEG targets communities and schools all parishes with relatively higher levels of school dropout rates, but coupled with the multidimensional child and household poverty. And the criteria for identifying the vulnerable adolescent girls include, for those that are in school, those that are in upper primary school attending the UPE, that is the Universal Primary Education Schools, are with high dropout rates. And for those that are out of school, it is adolescent girls who have dropped out of school and are vulnerable and are living in the selected parishes. That is the targeting for the GEG. The main objective for those that are in school is to keep the girls in school and support them to transition to secondary school. And for those that are out of school, the objective is to address the vulnerabilities that the girls face and to support them in their preparation to generate future livelihood opportunities. But also we emphasize when dealing with the out of school girls, we ensure that those that can rejoin school do rejoin school. But for those that are unable to, we support them to overcome their vulnerabilities, but also support them in preparation for generation of future income. Who are the program partners in the GEG? In the area of technical direction and oversight, we have the government through KCCA and UNICEF. The implementing partners, we have 2 NGOs, one supporting the in-school girls and the other supporting the out-of-school girls. The one supporting the in-school girls in terms of mentoring and referral to services is the Trailblazers Mentoring Foundation, that is the TMF. And that is, and for the out-of-school, we have the UIDEL, which is Uganda Youth Development Link. And for KCCA, we hand the cash transfers to those girls. Of course, for the M&A and research, we have April and UNICEF. That is how the design and implementation of the GEG program. We are looking at the support the development partners are giving in making the GEG program a success. UNICEF has supported KCCA in designing of the social protection program that does not only offer cash, but also offers complementary services. And we have seen this specific combination demonstrating promising results across education, health, protection, and also livelihoods. I just wanted to share just some small statistics that in 2023, which is this year, that is when our first group graduated to secondary school, we registered 92% transition of all our girls that were in school to secondary school. But we also have 51% of all the initially out of school girls rejoining school. But also we have registered improved livelihoods for those that are for both those that are out of school and those that are in school. But particularly for those that are out of school, 30% of them have been equipped with skills and are pursuing different projects to support their livelihoods. And also something that is surprising in the GEG is that there is kind of a multiplier effect that has not only, GEG has not only affected those that are termed to be beneficiaries, but also in our schools where we operate, there is a general belief that there is reduced vulnerability across those communities through a multiplier effect across the different pillars. Be it mentoring, we have seen other girls that are not beneficiaries benefiting from mentoring. we have seen even through COVID, not only our beneficiaries, but the whole households benefiting from cash transfers, but also referral to services. Second, UNICEF has supported the government of Uganda through KCCA, through the multi-year commitment and activities that include the advocacy, implementation support, but also evidence building. And this has enhanced the institutional capacity of KCCA to implement the child-sensitive programming and also increased its commitment allocating human resource to social protection. And in 2022, UNICEF supported KCCA through advocacy efforts and building the evidence base to mobilize 4.2 million euro from the government of Belgium. And through that, GEG was able to expand both horizontally and vertically. The cohort that we're having was supported, but also we had to enroll another cohort. So right now, GEG is supporting 3,000 adolescent girls, 1,500 of them in the first cohort, and then the other half in the second cohort. UNICEF also supported the identification of beneficiaries by providing KCCA with support with the program's targeting approach, which included the multidimensional child and household poverty analysis to identify the most vulnerable children. And this strengthened the targeting approach of the program and the national knowledge and capacity related to targeting. What are the lessons and good practices? One is development of national capacities and coordination mechanisms for social protection. There is a balance between the multiple municipal government actors who act as delivery agents and national government through the multi-level government and civil society steering committee. So as these people that constitute the steering committee identify with it, there is better opportunities of expansion. And if the program is expanded, it will lead to comprehensive approach to girls' empowerment. So if this program that is right now just in Kampala is expanded to other regions and girls are empowered comprehensively, it will lead to girls, even in the rural areas, not to drop out of school. And also it will curb maybe migration to the city in search of other services. This also entails integrating program management and coordination structures into the existing government structures. And this is an opportunity to strengthen the existing social protection systems through increased accountability and ownership. At KCCA, all management and coordination has been integrated into the mainstream. The other lesson is that the long-term commitments by development partners to expanding and improving cash transfers for children builds trust and political support. The multi-year commitment by UNICEF to provide financial, evidence building, technical, and advocacy, plus the implementation support, it was crucial in obtaining full and long-term commitment to the government, to the program by the government. And because of that, KCCA, from the design of the program, has taken a leading role, of course, assisted by the country office of UNICEF through technical support, leveraging on the organization's vast experience. But also it has allowed KCCA to develop robust plans for realization of the program's objectives. So the long-term commitment is very critical. The other is integration of cash transfers with service delivery to achieve more sustainable outcomes. Embedding a comprehensive and preventive approach empowering girls in the program design was a key success factor in gaining political support for the Cash Plus program. And by integrating the program design with the existing development services and strengthening services that support girls' empowerment and education, the outcomes for the beneficiaries are strengthened. UNICEF has strengthened, can we go back? UNICEF has strengthened the national social protection systems by building the policymakers' capacity to improve services, especially for the adolescent girls. But we'll find that UNICEF has also supported the development of the GEGMIS that tags cash transfers to engagement in other program components. We are currently using the MIS to pay off cash transfers. And for a girl to be in the eligibility list, there must be evidence in the program, in the system, that they have been attending say the mentoring session. So we do not want to give out cash transfers in isolation. There is the role of digitization in ensuring social responsiveness of the program. Digitization efforts are crucial for enhancing service delivery during crisis and ensuring responsiveness of a social protection system to shocks. During the COVID-19 pandemic, UNICEF supported KCCA to continue with program implementation through the digitization strategy. And finally, by fostering an environment of close collaboration and operational support, the various stakeholders can gain technical knowledge and can also be equipped with soft skills for improved coordination and communication. UNICEF has been highly engaged, a highly engaged collaborative partner, continuously providing hands-on technical assistance and operational support from the start of the program. But also the country office has been facilitating the sharing of knowledge and expertise with KCCA programs, with the program staff of KCCA, but also with partners. So thank you so much. We really thank UNICEF for the support in making this possible. Thank you so much.
Thank you, Annette. Quite interesting. Let's move to the next panelist. Over to you.
Thank you very much, Dennis. And good morning, colleagues. Good afternoon, to colleagues in other regions as well. My job is very simple. It's basically just to complement what Annette has spoken about. And just firstly to try and thank the government of Uganda through KCCA, I think, for really being the real lead in terms of implementation of the GEG project. I don't think without their support we would be where we are. So I think that's one key point, I think, from our side as UNICEF, that we have kept on pushing in terms of messaging that the leadership of government is priceless. And I think it's one key lesson that we have learned. In terms of us being able to to support KCCA, for those that may not be familiar with Uganda, Kampala is a huge metropolitan city, 12 million people during the day, and like 8 to 9 million during the night. So it's so big. And in terms of the budget, they actually spend much more than what the Minister of Health spends, annually. So you can imagine how big it is, and looking at the number of people that are there. So I think, in terms of us supporting, from our side as UNICEF, the first thing that we have basically been trying to do is to make sure that we utilize, to the extent possible, as much evidence as possible. This is a project that was designed out of a clear, research that was done in Kampala in 2017-18 that tried to establish what were the main issues and main challenges that are faced by the girls in Kampala because of the many things that could be observed. But instead of verbalizing some of these things, I think an effort was made by the people then to try and put together all this evidence to see what sort of interventions would be necessary to try and support the girls. So I think this is one of the key things that I think us as UNICEF we've continued to do and will continue to do. So what we did is in terms of then trying to support the targeting was to make use of the evidence that we have around child poverty. We've got a robust program around child poverty where we do small area estimation of poverty and so on. And what we did was to try and then help in terms of the geographical targeting of the program, because, this is, being a metropolitan city, there are lots of challenges, lots of interest politically or otherwise. And in order to implement such a program, it has to be based on evidence to show why exactly you're doing what you're doing and in those specific areas. So to try and avoid the situation where there are contestations in terms of the targeting, we basically try to use all the evidence we have. I think the second thing also that we as UNICEF value in this partnership with Kampala Capital City Authority is our partnership in the true sense of partnership. We are not in any way, presenting this as a situation where we are giving government money and they implement, or we're giving partners money and they implement. We work side by side. We support each other. KCCA supports us in the spaces that are relevant for government to support us, but we also support KCCA and our two partners in terms of what needs to be done. Where there are opportunities for capacity building, we have continuously tried to do this on very specific issues. For example, as part of the reforms to the program, to take into account challenges related to disability, how do we ensure that the program is disability sensitive? And I think we've really included those elements around our capacity building for both for KCCA, but also for our partners. The power of knowledge generation, we have embarked on a series of reforms to the program. If you had seen the program when it was started in 2019, and you would see it again today, there are so many design tweaks that we have done, including all those issues to do with inclusion, of deliberate inclusion of issues that have to do with addressing specific issues on disability. And this doesn't only relate to the disability top-up that we've given, but also issues that have to do with assessment for disability, but also mentorship for those girls and families that are impacted, that have a member or a beneficiary that is living with disability. So part of that knowledge generation supported by EPRI has really been quite helpful in terms of us refining our targeting, but also ensuring that we improve the impact. So this is a continuous process that once in a while we also try to generate. And I think right now, just recently, we're actually in the process of finalizing the evaluation of the first phase of the girls that will be exiting from the project in December. And we have quite a lot of learning, both in terms of targeting, in terms of messaging, as well as in terms of the partnerships that are coming from there. I've emphasized the issue of the importance of the leadership of government, that this is indispensable and an important part of the program, but also the political support. So, like I mentioned, Kampala being such a huge city, there is a lot of politics that is involved in terms of targeting, in terms of interest and so on. And it's not an easy space that you can just go directly to do community targeting, but the importance of moving with all the leaders and explaining to them why certain areas are chosen, why certain beneficiaries are chosen, ahead of others, why, for example, we're also including, for example, other special interest constituencies like, the refugees and so on, because we have actually included some of them. Why, for example, teenage mothers perhaps are also being supported and so on. So getting the political leadership right from the grassroots, right up to the ministry level is really quite encouraging for us. And I think seeing the uptake that we have now, not only at KCCA, but with the lead ministry, which is the Minister of Gender, but also the discussions that we're having with Parliament, it's so encouraging because the program, MIS is going to be linked to the National Single Registry, and I think that's one key point that we are looking at. So, as part of those conversations, there is potential for expansion. From the government side, nothing committed really at this point in time, but it's our hope that will happen. But we already have quite a bit of some pressure from the government to say Kampala is only but just one urban settlement that we have in Uganda. So why don't we try to look at the same thing in other urban settlements? We are looking into it. We've got questions like the possibility of implementing the same program in a rural setting. But like Annette said, I think this is something that we also need to look at very carefully, because every other area is different, because this program basically depends a lot on mentorship. So the capacity to do the mentorship is also very important to ensure that the program succeeds, because cash alone will not achieve much. So I think that's part of what we, I think us as UNICEF are supporting. And I think we are partnering with KCCA in terms of trying to also advocate for government financing and uptake of this program. Progress is there, but it's a bigger conversation in Uganda because of the nature of social protection in Uganda, but we still remain quite hopeful that at some point we are going to be able to score successes. So I think this was just to compliment Annette. Thank you very much, and back to you, Dennis.
Thank you for good presentation. And I think we're going to move directly to the next good practice. And to presenter, we're going to have a Q&A session at the end. So please keep your question. You can put them in the chat as well, and Anu can kindly collate them for the Q&A section. So our next presenter, and for the good practice, is coming from another region in India, and we have a colleague from India Country Office. So we have Yun Iban. Hopefully I pronounced well your name, Yun. She's the Chief of Social Policy for UNICEF India, overseeing the social policy program and social policy evidence agenda, which include 13 UNICEF state offices, supporting government and development partner in the area of child and shock responsive social protection system, public finance management, and child-friendly local governance, as well as SDG localization initiative. She joined UNICEF headquarters in 2003, and her professional experience spanned UNICEF headquarters, supply division, regional office, and field offices, and international non-governmental organization, including in the US, South Sudan, Kenya, Jordan, Myanmar, Denmark, and Switzerland. Her colleague, also from India, is Ms. Veena Bandyopadhyay. Hopefully I'm doing justice to your name. Veena is a social specialist in UNICEF New Delhi. She's a social development professional with more than 25 years of experience and working with the United Nations, international organization, and bilateral cooperation in the area of social policy, planning, and advocacy. She has a vast experience of working across state in India and South Asia country, and a profound understanding of the issue related to poverty, gender, right, and social exclusion. She's currently leading several multi-state initiatives with extensive focus on gender transformation agenda and cash plus. So that is good, and we have a question for you in the chat. That is. Colleague from UNICEF India Country Office also joined this webinar that needs to be highlighted because they are the origin of the good practice from the BR state. So we have with us the Chief of Field Office and Social Policy Specialist from BR, Nafisa Binte Shafiq, and Social Policy Specialist from BR Office is Abhay Kumar, and M&E Specialist from New Delhi Office, Uvrarshi Kaushik. So welcome, and over to you, please.
Thank you so much. It's so great to see everyone here, especially my colleagues and friends from South Sudan, as well as in the Eastern and Southern Africa region where I came from before joining UNICEF India. And I'm joined by Veena, who leads the social protection portfolio in India Country Office. And in addition to the BR UNICEF office, colleagues Nafisa, Abe, I wanted to also acknowledge Prashana, who was OIC Social Policy Specialist in Bihar, as well as Urvashi, who also played a critical role in terms of the NKUI program when she was in Bihar. And especially as my colleague for Uganda mentioned, the leadership of the state government of Bihar, for actually spearheading a social protection program focused on the girl child, the adolescent girls, and young women, because it is very critical that the government plays a critical leadership role. Just to give you a context, so we the Bihar is a third largest, largely populous country in India, over 100 million population size. And there's a lot of kind of social norms that the MKUI tries to address. The state recently also launched a specific action plan around children. So we just wanted to comment because it builds on, and this is a great opportunity to take the program forward using the state action plan that UNICEF has supported. For those audience who are not familiar with UNICEF India, I just wanted to mention we have been in India for the last 74 years supporting government. And we have 13 field offices that cover over 20 states and 2 union territories. And we are structured in a multi-sectoral manner to deliver multi-sectoral technical assistance to government. So we work with many ministries and departments, including Women Child Development, which is our nodal ministry, but also health, education, WASH, ministry and departments of finance. A few of you talked about the importance of creating fiscal space for universal child benefits, as well as local governments, both rural and urban. And within social policy, our public financial management program is there, as well as local governance. It is very critical to ensure we have concrete investment cases evidence to ensure that there's a case to be made to invest further in universal child benefits. And why is it important, especially the local departments of finance? 41% of the national budget fund flow goes from national to state to local government. So we have a particular focus on decentralized PFM program and UNICEF. And I wanted to mention all of our programs are focused on the equity-based approach and gender transformation, and it's a key priority under our 5-year country program. And you'll see from the MKUI program how it looks like it focuses on an integrated social protection program that includes complementary services or cash plus components to deliver multiple development outcomes for children. So, and this is based on global, regional, and country level evidence that shows, and I think it's highlighted in the evaluation report, that social protection programs tend to report higher impacts on girls and women. I think it was mentioned by maybe Denise as well as Michael, and especially when it's linked to cash plus components such as education and employment. So I won't cover much. We'll try to respond to the questions from the participants. But before I conclude, just to mention that we also have, we are supporting state governments in over 8 states around girl cash transfer programs. So the learnings that we have from MKUI is being shared with other states where we work with state governments to design and implement cash transfer programs, focus on the girl child, adolescent girl, and also with the explicit kind of objective of preventing child marriage. So without further ado, let me pass it on to my colleague Veena. Over to you.
So thank you, Yuni. And first of all, I would like to thank IPRI and UNICEF Global Office of Evaluation of UNICEF for providing this opportunity to share India experience and also help us throughout this journey. The discourse has been very, very relevant around UCB, and especially the investment and understanding of all the national government, including India, has been slowly shifting towards expanding social protection program. So it is an opportune moment for us to increase the dialogue and enhance our effort towards universal child grant. So may I go to the next slide? Yeah. So just quickly to provide social economic context of Bihar, which is one of the states of India. India has 30 states and 5 union territories. Bihar is one of them, which shares 9% of India's population. It has significant lowest level of poverty, 51%, to 52% multidimensional poverty, and while 33% of the population lives in extreme poor situation. So I will not go to each and every figure which is given, but the state also hosts a large number of adolescent and child population with the fertility rate of 3. So it is way behind in terms of replacement parameter, and so investment in children and youth continues to be very, very critical for bringing about any development, to have any significant impact on development outcome. Sex ratio in many Indian states have been going haywire and have been like very, very challenging issues to address. And Bihar is 6th lowest in amongst the states of India when it comes to sex ratio. Some of the districts show much poorer state. Per capita income remains the issue. Child marriage, which is about 40%, you can assume that 50% of the population, girl child population, is vulnerable, and young children are also vulnerable. In terms of gender gap, poverty and gender gap, there are some information which is for your reference. Can we go to next slide, please? So the trigger for UNICEF to engage in supporting the girl child cash transfer across the state, it began in early 2018, where we supported Kanyashri Prakalpa in West Bengal, and then following to that, this particular program in Bihar, where the request from the government was received to support and utilize the birth registration grant that was targeted to BPL families to incentivize and protect selective female infanticide and feticide. UNICEF took that opportunity to convince the government that just by providing certain grant to BPL families, promoting girl child and saving girl child may not be sufficient enough to achieve the outcome. Henceforth, it was important to undertake gender analysis in terms of also looking at life cycle vulnerabilities of across gender continuum, and that is what triggered certain action in terms of building the evidences. So first was the undertaking gender analysis, gender gap analysis, mapping of all social protection program that align to addressing various vulnerabilities, and also undertaking fiscal space analysis to support the program design. So what it led to is here, which is presented. So it helped UNICEF to support government in bringing 19 existing cash transfer program together and supporting bringing into 7 existing intervention and 4 new intervention. The program, which is known as the Mukhyamantri Kanya Utthan Yojana, introducing this umbrella program in early 2019, formally government announcing the program as a universal unconditional cash transfer program for all girls. The program recognized the life cycle advantages and focused on addressing life cycle challenges to 23 cash transfer, and the transfers were made to parents' account and as well as account of children. The effort was also made to support cash grant during birth to incentivize girl child birth and Aadhaar registration, immunization. Other plus components were also linked. Then there was also menstrual hygiene management, which was recognized one of the main reasons for young girls to dropping out from a school, in addition to the quality of education and distance and all other thing, which was also taken care of. So overall program aimed from zero, so its life cycle approach and advantages that is addressed by these intervention program reached out from 0 to 18-year girls in particular, and after marriage. So it covers the spectrum of 0 to 21 year with various cash transfer, which is indicated in the slide and including the amount. So total about $650 as per the current rate. When program was introduced in 2019, it was about $800. So that is where the program goes. Can I go to next, please? So in terms of what led to the, so there has been two phases of the program, which is which if I can say, one is the initial arguing and engagement and providing evidence to bringing all the all the schemes together, all cash transfer to address life cycle advantages, primarily focused on cash transfer and bringing cash transfer together in more integrated and comprehensive manner and making it universal. So later on, further evaluation, concurrent monitoring and MIS study with IPRI, with support from IPRI was done, which helped much more systematically articulating the plus component, which I'll highlight here and refer later on as well. So first was that first Universal Mukhyamantri Kanya Utthan Yojana in 2018 has been one of the unique and first of its kind in terms of non-poverty targeting criteria integrated in universal cash transfer program. The program followed life cycle approaches and where we brought 4 new element in 7 existing across, which was referred to earlier slide. Fiscal space was enhanced through fiscal analysis as 19 program and scheme, they were transferring fund small to big and moderate and at various levels. So the saving was made to top up the amount, especially saving from those programs that had a very low uptake and no uptake. Plus component was introduced in terms of financial inclusion, which is opening additional amount account for girls, and also exposure visit to public places like bank, post office to improve mobility, capacity development around gender, and continue technical assistance to stakeholder to implement other program and bring the linkages in terms of at local level from at Gram Panchayat. So national, sub-national and Gram Panchayat level strategies and technical assistance were provided. In terms of successful policy advocacy, the 3-level changes that that was leveraged by UNICEF. One is bringing about entire policy changes to bring integration, convergence, and making it universal and life cycle approach. In terms of design implementation, selecting conditionalities that has positive connotation and that helped keeping bringing girls in a school and sustaining their primary to secondary transition. Also supporting in terms of cash transfer and last mile delivery, building this entire effort also built the case for universal child grant, which has helped our going case at national level, and many other states we are trying to replicate some of these. Social behavior change communication has been integral part of almost all program that started with this program experiment and its success, where it was high level launch and plus component that included parental counseling in particular, because keeping girls in school and bringing girls in school, not allowing marriage is triggered by a larger ecosystem where a community had to reach out with certain kind of communication strategies. Parental counseling, structured parental counseling was done through social behavior change communication. There are life cycle module and gender training, those were operationalized. In sectoral convergence, this comes to very unique, this has been a unique advantage of UNICEF, because UNICEF itself has a very organization which works on the very core programming that concerns children, health, education, nutrition, and child protection, in addition to social behavior change communication and communication. So we, together with all our sector within UNICEF, were able to mobilize interministerial coordination and engagement with other sector, which helped bringing all sectors together to make the integration and universal linking the services more successfully. Multi-sectoral engagement with other partner, in addition to global partner like IPRI, and there has been large number of civil society organization in addition to government that were also brought in to support program delivery to the last mile, to support monitoring, and to contribute to design and advocacy. Next slide. So in terms of few lessons learned and some of the good practices that I'd like to highlight is that evidence building, as has been throughout, starting from Michael, Dennis, and other previous colleague, has highlighted, and this is UNICEF's recipe to success. Building evidence and sharing evidence has been critical driver of the change that UNICEF globally and in India has been driving. And especially in India, this becomes very helpful where our resources are very tiny, where government has lot of resources and a lot of program are designed, except that sometimes capacity evidences are not enough and adequate to convince the political representative and bureaucrats to what makes sense. So this has been one of the major trigger. In case of Bihar, the evidences were generated through gender gap analysis that informed theory of change, mapping all cash transfer program to rationalize financial efficiency and adequately support the program, and documentation, process documentation, and case studies that fed into this. This helped bringing in terms of theory of change for universal child grant that made financial sense and that made programmatic sense, helping the improvement of design and introducing umbrella program, which is known as Mukhyamantri Kanya Utthan Yojana. The other thing which I'd like to highlight that this we don't see it or with government that it's one-time effort, because the program, once it is introduced, it has to be continuously monitored, watched, and also respond to dynamic situation, including like COVID. So we are also seeing how that government can be informed in terms of ensuring the program dynamism, which is adaptive, anticipatory, links to social protection need, also response to social protection need, and also sustained in terms of fiscally constrained environment like during COVID. So our engagement has continued, which is going to be long-term engagement in terms of systems approach, which is backed by legislative and policy commitment of a state government, and also some of the lessons may inform national advocacy. The second lesson that other than the evidences has been the sustained engagement of UNICEF in program implementation support. Unfortunately, the program was introduced in late 2018 and early 19, which was formally introduced. And then globally in India, we all were stuck by COVID-19 crisis, and which had a catastrophic impact. A lot of Bihar being the source of migration, many people came back, and a lot of there has been program disruption. So program implementation support and through technical assistance for quality assurance has been our critical strategy, which has worked for us and continues to work, which focuses on continuous engagement with multi-sectoral ministries and to bring cohesiveness and synergy in the programming approach. Also building capacity through systematic training programs and modular courses, program monitoring support, which is integrated MIS scoping study that informed progressive effort for single registry and registration that has continued. It is still a work in progress, while concurrent monitoring and process documentation has helped inform government to make necessary program adjustment in terms of transfer, and also identifying middle level and local level functionaries who can facilitate grievance redressal and reaching the service to the last mile. So this will continue with focus on program coverage and quality assurance support as a part of Mukhyamantri Kanya Utthan Yojana, which is going to be our sustained effort. May I go to next slide? In terms of future implication and way forward, as Uni also mentioned, as we see, one state of India is also bigger than many countries. So one small program that we see as very, very small sometimes is too big for external audience. But within India, this can trigger a change. So what we have continued to support government of Bihar in improving Mukhyamantri Kanya Utthan Yojana implementation, especially with focus on creating expanded fiscal space using our public finance management expertise. Other thing which is in progress, and we continue to support scale up beyond Bihar, and expansion of universal child grant, which is through multi-state study of girl child cash transfer, and also looking at large flagship programs such as rural employment guarantee scheme and public distribution system of food, where child component can be easily mainstream, such as in the form of creches or in the form of parental and maternity leave and maternity benefit. So which means that vertical and universal child grant introduction and strengthening across the state, but also building the linkages with other larger flagship programs such as food security and nutrition program and employment guarantee program. The third one, which is the way forward for us, and we have been working, is joint communication is and advocacy strategy with other UN system and like World Bank and the ADB and other bilateral agencies such as GIZ and many other agencies that are working in India, working on similar agenda like IPE Global to communicate and advocate for cash plus. So whether it is cash transfer for food and nutrition or cash transfer for girl child and adolescent empowerment, that there has been effort, and we are very sure that by the end of this country program, there will be far more greater acceleration achievement on these account in terms of institutionalizing cash plus. It increase advocacy for enhancing child sense. As I mentioned already, the two programs that we have identified in addition to child-specific program is building linkages with employment and livelihood program and food security and nutrition program, where the child lens and child sensitivity agenda is to be integrated through creches and through other cash plus program in terms of orienting nutrition to orientation. Leveraging global expertise and engagement. I think in India in particularly, I'm sure this may be true for global office as well. Engagement of expert agencies and global agencies has been key trigger to bring change, because it brings a lot of credibility to the evidences which is working globally and other countries, and also adds to India's rich evidence and experience, because any investment in India cannot be small given this large population size. And when it is backed by global evidences and credible research institution and credible work, it gives more confidence to government and partner and UNICEF to go for those changes with little hesitation or no hesitation. Next. So thank you. I think I will close here. If there are any questions, I would be happy to answer. And I would request other colleagues to join and supplement if there is anything. Over to you.
Thank you, Veena and Ian. I think that's reached the end of the presentation. We are open up now for question and answer to the audience. Anu, help me with the question in the chat, and raise your hand, please. You may want to indicate your question and to who as well, if it's India or Uganda or the speaker. Thank you.
Denny, I have just pasted the question on our chat for you to take up.
Okay, thank you. Let me read it out from Shepherd Mupen. I don't know if we know the country. Financial resource limitation is often highlighted as the reason for failing to provide comprehensive social protection coverage toward universal coverage. Let me go up. I lost the chat. Okay. Financial resource limitation is often highlighted as a reason of failing to provide comprehensive social protection and UCB. This is the case in many parts of Africa. What advice can you be given to government to achieve adequate and sustainable funding toward the universal coverage? I know Michael has a good answer for that. I don't know if you want to go first, and then please raise your hand, any of the panelists who would like to come in. Michael?
Sure. Certainly moving straight to universal can create a big financial commitment. But what we've seen many countries do very successfully is to start with a specific demographic group, for example, children under 2, and progressively expand to universalism, or start with the most vulnerable communities, the most vulnerable districts. The combination of geographical and categorical targeting is one of the most effective ways to progressively scale up a universal child benefit, and it is affordable in every single country in the world.
Thank you, Michael. Anyone want to come in on this question or I move to the next question? You raise your hand. So let me read from the chat. This is a gender question. So let me know which panelists want to come in. From Juma Firi. My concern, however, is that there are more support for on the girl child with little or none support to the boy child. What is the position of UNICEF for the next decade and beyond in terms of exclusive support for boy child? Otherwise, I foresee an economic gap status for the affected generation with an economically supported gender bias toward the female. Your comment, please. This can be from any of the UNICEF. I can come in as well. This is so true. Another is in the same question. This is so true for Namibia as well. Recent evidence is showing that boy indicators are now lagging behind those of girl education, enrollment, and attainment, access to service. So let me pause here. Gender approach to UNICEF, but why focusing the imbalance? So who wants to come in?
Sure. Thanks very much. Yeah, I can come in briefly, but I think, the other colleagues will also try to come in. And I think for Uganda, this is very context specific because of the many challenges that we face here, and more specifically in Kampala. We had a dialogue on Tuesday around social protection as part of the Social Protection Month, and the main theme was around financing social protection across the life cycle. And I think one of the key things which has been happening is that I think there are specific interventions that are targeting specific groups, for example, the elderly, the disabled, and so on. But for Uganda, there was nothing really, focusing on the adolescence group. The biggest challenge we actually, face here is that there is so many, as Annette highlighted, vulnerabilities that are, encountered by this, very specific group. And I think, whilst I think there may have been interventions, they were so omitted in many different spaces. And what then, just by way of, of an example, that on Tuesday, I think there were also sentiments that were pointing to the fact that as much as 1,000 girls were getting pregnant during, the COVID time, right? It's not that this was a new thing, it was still happening every day. So you're looking at 1,000 girls getting pregnant every day because of the vulnerabilities that they were facing. And this is mainly emanating from how they are staying, the economic challenges, the many different challenges that have to do with regards to access to many different social services. And the question is, for how long can that continue? So I think this is, part of why I think something had to be done around this, this target. And maybe Annette didn't highlight this in the presentation, that our targeting is basically from 10 to about 14 years to start with. And I think with the proof of concept that we now have in terms of the impact, because let's not underestimate the impact that a girl that is getting support through mentorship, linkage to services, and a small cash transfer makes a decision out of their own will to say, no, I don't think I should continue out of school. I need to go back to school out of their own will. I mean, this is, I think, one of the key things that we have, we think maybe, as part of trying to work on the second decade, basically perhaps would be able to, to benefit from this intervention. But maybe you can also come in.
I'll just come in briefly about engagement of the boy child under GEG. Though it's girls empowering girls, we try to the extent possible to bring in the boy child, because as we mentor these girls in school, there are boy children in the class, even in the communities. So what we have done at implementation level is that we ensure that even the boy child can benefit from the mentoring. We provide information not only to the girls. We have seen more children coming into the mentoring sessions that are not part of the program, both in the schools, but also in the community. Even when it comes to referral to services, it is not restricted to the girl. Well, we have seen it going beyond the girl to the whole family. But also through the Girls Empowering Girls program, there's improved livelihoods among those families that also impacts on the boy. So to the extent possible, we involve the boy child, but there is also involvement. We have blended our mentoring components to go beyond the mentors that belong to the CSOs to bring in the community structures. We have teachers as mentors. They don't only mentor girls that belong to the program, but the schools. We have chairpersons for the villages and communities. We have women leaders that do mentor the community beyond the girl child that is in this program. Thank you.
Don't know if, yeah, Yon, over to you.
From India, so we have a national campaign by our nodal ministry, Women, Child and Development, which is called Beti Bachao, Beti Batao, which is save the daughter, educate the daughter. Because so all of the states where we have a specific focus on the girl child are those where the sex ratio at birth is skewed towards a male. So it's part of also the national priority in the program. And we are seeing, I just in the chat box, based on Shepard's question, talked about the ongoing multi-state girl cash transfer program that we're undertaking. And some state-specific findings show that it has shown some improvements on kind of in terms of the sex ratio. So those are where there's a strong gender and social norm that we need to address and to enhance the value of the girl child. So, but I do agree. So it is based on analysis. Veena mentioned that we supported the gender analysis. So it's based on evidence on who are the most vulnerable and left behind. And if there's specific vulnerabilities for boys and adolescent boys, of course, as UNICEF, our position is that we would design, advocate with government to design and implement the program that address those specific vulnerabilities for boys and young men. So over to you. Oh, and then second, in terms of the fiscal space, that just to share, it was very powerful in Nepal when we recently went with our Ministry of Finance, and there were from 8 countries in South Asia and other countries, and we learned about the Nepal Child Grant Program. And it was a former Minister of Finance who actually initiated the child grant because he understood also the fiscal constraints, but he was the one who was able to also create the fiscal space. And he was convinced based on the evidence that if you invest in a child, you generate actually the highest return, social and economic return on society. So it was, you know, it is really about evidence-based advocacy. So UNICEF across the world, we have many of these examples where we try to share with the government and with thanks to also partners such as EPRI who help in those evidence generation activities. Over to you.
Thank you, Yon. So you want to come in, Michael? Your mic is on.
No, we can go on for more
Okay,
questions.
your
I'll
mic is
come in.
on.
Oh, sorry.
So yeah, so UNICEF approach on this, and I've seen another comment on the chat, is without being a gender specialist, I think gender is really to look at imbalance among gender. Is not by design favoring girls, but it's and often girls are in defavored or they're in worse off position. So that's why you see more girl intervention. However, in some context specific, in some country, you're gonna have boys, as rightly pointed out, the example of the drugs with adolescent in Brazil, for example, the adolescent, most of the boy that has been having a protection issue with police. So the intervention here is with boys, adolescent, it's not with girls. So UNICEF is gender favoring a gender balance approach, whatever the sex, and it's looking at the power dynamic of through that gender lens. Thank you. Let me move to other question. How much come on, I appreciate the program in Uganda because it make interesting package. This is not a question. Okay. To Annette and Tawanda, how much funding is KKCA allocating or planning to allocate? What is the institutionalization and sustainability plan? That is one. And to Veena and Yon, even you have already partially answered, how has the impact of the cash transfer on poverty among the target group been measured, and what has been the result? Vina has expertise on genders. Yeah, okay. So over to Uganda first.
Thank you very much. So the good thing is that we also have colleagues from the Ministry of Gender who also who lead in the discussion. So I think we'll just give the floor to Paul just after my interventions. So Paul, be just prepare. Sorry for putting you on the spotlight, but I think like in any other country, every other country faces problems of fiscal space. The situation in Uganda is perhaps not different from any other country, for example, of a similar nature. Issues around how debt is managed, what opportunities are there, for example, to be able to come up with sustainable ways to finance social protection. But I think on our side, what we have seen, I think, from UNICEF is the goodwill and the political will at all levels of government. It's really encouraging that the country has a very clear strategy in the National Development Plan is clear. Over the past 5 or so years, I think we have seen the growth in the number of social protection programs, which was never the case many years ago. And I know Dr. Samson, Dr. Michael, who has been here and working for many years in Uganda, knows the evolution of the Ugandan story. And the changes that we are seeing, including, for example, what we have seen around what's happening on GEG, the attention that it's getting, both from the government itself, but also from the political leaders. Just last week we had the delegation from Parliament who requested to come and have a look at this project and see what it was doing. And I think the impact has been so amazing. And we feel strongly that the opportunities to explore more government support to social protection are there. And it's not long before we see a rapid expansion in some of the interventions. So I don't know, Paul, if you would want to come in, Paul Onapa.
Yeah, thank you very much, Mr. Tawanda and colleagues. I don't know if I'm very loud and clear.
Sure.
Yes, I can proceed. Thank you very much for this very interesting presentation. And very quickly, as you noted, our fiscal space for financing social protection is very, very low. At the moment, we're spending about 0.7% of our GDP. And this is quite very low if you compare to our neighbors in Tanzania, in Rwanda, and Kenya that are spending over 1%. But what is also very important, even is the direct income support, mainly cash transfers, like we're talking about today, is even much, much lower. And most of it is spent in others, which is the public service pension scheme. And therefore, for us, we currently are concluding a paper supported by UNICEF on investment case for social protection in Uganda. And one of the chapters is on the fiscal space. We had, as you indicated, a conference, social protection dialogue. And one of the things that we're looking at is how do we enhance the fiscal space for financing social protection? And we have already engaged on how do we leverage around creating a social protection fund. So right now, as we engage, the discussion is how do we create a fund? And what will be the sources of financing this fund? And we're already having engagements with very many stakeholders and hope that maybe this will go a long way in helping us to increase the fiscal space for financing social protection. I thank you.
Thank you. Over to India, colleague. If you want me to repeat the question, I can.
Do you want to take that? I tried to put my response in the chat
Can you
box,
repeat
but
the question?
it was
Yes.
about the impact of child cash transfer, right?
How has the impact of cash transfer program on poverty among the target group been measured, and what has been the result? There's another one, by the way. That is one question. The other is similar to what we are doing in South Sudan with integration of complementary social measure aiming to positively influence household behavior and practice related to critical area and human capital development and enhance household. Will be good to learn and hear more on the following experience on light touch messaging and intensive complementary measure beneficiary targeting criteria in case of indirect income support, labor intensive, public work, etc. I don't know if we understand the question. Anu, can you just paste it in team to Vina and Ion, please?
Yes, I will.
So just on the evidence, so I was putting on the chat box, there's a lot of social protection programs, both at national and state level. As I mentioned, India it works in a decentralized context. So the MKUI was devised by the state. As UNICEF, where we operate, we have been providing technical support to the government around program implementation reviews, looking at the barriers of accessing the social protection benefits. What are other design tweaks that can be done from a child-sensitive lens? In terms of the evidence itself on the rural cash transfer programs, there's an ongoing multi-state study that we're doing across 8 states, working with our state counterparts. But initial state-specific findings show that there are, positive trends in terms of reducing multidimensional poverty. So looking at the health indicators, the education and the education outcomes, even the right to birth being registered at birth. So we have been seeing some positive signs. Once the study is finalized, we will be organizing a series of dissemination events, and hopefully we'll be able to share more in detail. And then I believe the question from Arafa from South Sudan, I don't know, Vina, if you want to add on around the SPC, complementary measures. I think you touched upon it a little bit. Because in South Sudan, they have also a public works program, child-sensitive public works program, focused on human capital development. So over to you.
Thank you, Yuni. Just to complement, first of all, this impact of cash program on poverty reduction. Why only question the cash? Because all the programs impact, all development intervention impact on poverty reduction, then should be questioned. There are proven evidence within India and otherwise, any form of cash to that supplements family income has a positive impact because it provides family little bit more space to make their choices and prioritize what they would like to, and giving them choices. As far as evidence is concerned, one evidence which is consistently across the states in India are emerging that in the last decade, since the cash transfer for girl children has been introduced, continuity of girls to primary, secondary, and higher education has improved, and it has to be directly linked to cash transfer, because given the family income, the priority is always to continue the education of boys rather than girls, because girls will be married, they will be getting married off and going away, and also they support families in household chores, and mother wants her daughter to support her so that she can go and earn some additional income. So there are proxy indicator and direct indicator on the impact of cash. However, the debate is whether the cash is sufficient, whether the cash is reaching on time. Those are the issues that must research. These are bigger research questions that must be examined in terms of value of cash, rather the amount of cash and cash in hand of people at what frequency and when they need. So that is what our experience is. In terms of social behavior change communication, the evidences are little mixed in India, and you would agree, we all in UNICEF would agree that most of the social behavior change communication across social protection programs are as add-on and mostly driven by UNICEF engagement with government. So the social behavior change communication and so has never been integral part of the design of cash transfer. So it is like supported by theory of change, addressing all the assumptions. So those are the issues in terms of that we continue to advocate and have to see that it is integral part of the design. The last thing which I wanted to highlight to colleagues from Sudan is that engagement on any program, whether it's food security and livelihood or public works program, it is important for us to recognize that access to routine social protection schemes to poorest of the poor in normal time will help them to not only sustain the life with dignity, but also save for future emergencies such as shocks and crises. Henceforth, one of the approaches that in India we are taking is to provide any programs that are targeting poorest of the poor, such as employment guarantee scheme or food security and nutrition system, there has to be system like in social protection clinic, providing them at door social protection services, so that in routine time, poor have access to social protection services and entitlement. So we are all learning together. I don't think, yeah. So I hope I could answer and supplement Yoonhee's earlier remarks. Thank you.
Thank you, dear, for your response. So maybe a short closing remark from Michael and then from me, and then will be the end of this. Over to you, Michael.
Thank you, Denis. And I want to thank all of you. This is one of the best attended webinars we've had since COVID. It's great to see all this interest. And as countries develop communities of practice, as for example, Uganda has done, these kinds of webinars and South-South learning will become more important than ever. I want to come back to two key things Yoonhee said. One, the case of Nepal, because somebody asked, are these universal programs affordable? And for more than a decade, Nepal has progressively scaled up demographically, geographically, in terms of benefit size, that is, we say vertically, and diagonally, intersectorally, incorporating cash plus programming. And Nepal faces some of the most constrained finances in the world. But as Yoonhee mentioned, it's the evidence-based advocacy and the just-in-time evidence supporting the investment case that has been so important. And we heard that from the government of Uganda as well. But the second key point is also so important. She mentioned that cash plus programming leads to multiple developmental outcomes. And as we ride the second wave of social protection, integrated social protection programming, we see on the horizon the third wave that tackles the enormous challenges of climate change. Governments around the world are managing a just transition to green and sustainable development. And social protection, universal child benefits in particular, and cash plus programming, it's the best way to nurture the billions of young brains, the children that will grow into adults who must tackle this problem. And a smart economy is a green economy. Social protection provides the social dimension of integrated climate development and equity strategies that enable this transition to green and sustainable economies and societies. And by the way, that also opens the door to the hundreds of billions, eventually the trillions of dollars of green finance as we link social protection to these just transition strategies. Thank you.
Thank you, Michael. Very interesting as usual. So I want to close this meeting. Just for your information, the global evaluation report is available, publicly available on UNICEF website. Is going to be presented to the executive board in February 2024. No, it's the global evaluation, so no case, no recommendation to the specific case, but the global recommendation to the global team. So I invite you to search for the report. You can write to me. I put my email, or you can Google it. It should pop up, or you go on UNICEF website looking for the report by title. It's available. But if you have difficulty, reach out to me. So thank you for all participants in globally in the room. Thank you for all panelists. First, the India country colleague and office. Thank you for your sharing your time and your experience. And obviously to the Uganda country office and team to not only to share their experience, but also to support us and to host this global webinar. So, and obviously thank you to Michael and the team, Anu and Beverly online doing the work behind the scene. So thank you all and wish you all the best. Thank you.
Thank you, everyone.